Did you know that persistent itching in certain parts of the body might be your body's subtle way of signaling cancer? Many people dismiss the occasional itch, especially as they age, assuming it's just dry skin or a minor irritation. But for adults over 60, specific types of itching, especially in targeted areas, can sometimes be an early clue to something more serious. In this video, we'll explore 5 specific areas of the body where itching may actually point to cancer. Sometimes even before other symptoms appear, these aren't just random irritations. They're patterns that doctors have repeatedly observed in patients later diagnosed with serious conditions such as lymphoma, pancreatic cancer, breast cancer, and skin cancer. Watch until the end. Not only will we identify the body parts, but explain the underlying reasons why these areas itch, what types of cancer they're linked to, and how to tell the difference between a harmless itch and something potentially dangerous. You'll walk away knowing what to watch for, which questions to ask your doctor, and what steps to take if these signs seem familiar. Most importantly, this isn't about creating fear, it's about paying attention. The earlier you notice the body's quiet signals, the better your chances of catching a condition before it becomes harder to treat. Sign 1. Persistent itching on the lower legs. If you're older and have a chronic itch on your lower legs, especially around the shins and calves with no visible rash or irritation, it may be more than dry skin. This symptom has frequently been observed in people later diagnosed with blood cancers, especially lymphoma. This kind of itch is persistent, worsens at night, and doesn't improve with moisturizers. It occurs when cancer in the lymphatic system causes inflammation that affects nerve endings deep under the skin, even when the skin itself looks normal.
For example, Johann, 76, shared that his only symptom for 6 months was an unbearable itch on his lower legs. Initially mistaken for eczema, tests eventually revealed swollen lymph nodes and a diagnosis of lymphoma. His story isn't uncommon. If this kind of itching continues for weeks, especially with other subtle symptoms like night sweats, fatigue, or unexplained weight loss, it's worth discussing with your doctor. Sign number 2. Itching between the shoulder blades. A deep, focused itch in the upper back, particularly between the shoulder blades, is often overlooked. But in some cases, it's linked to pancreatic cancer. As tumors in the pancreas block bile ducts, bile salts build up in the bloodstream and can irritate nerves in the back. This causes an itch that feels like it's coming from beneath the skin, often months before any digestive symptoms appear. Lisa, 71, called it a phantom itch that no cream or lifestyle change could fix. Eventually, blood work revealed elevated liver enzymes, leading to a scan and a pancreatic tumor diagnosis. If this type of itch is persistent and paired with symptoms like fatigue, darker urine, or pale stools, it's time for a medical evaluation. Sign number 3. Itchy scalp with no dandruff or flakes. Many older adults experience a dry scalp, but when the itch becomes chronic without visible signs like dandruff, it could be more than just dry skin. This can sometimes point to leukemia or skin cancers on the scalp. The sensation is often burning, tingling, or crawling, unlike typical dryness, and doesn't respond to regular shampoos or treatments. Johnny, 75, ignored his itchy scalp for months. After a routine blood test for fatigue, he was diagnosed with early-stage chronic lymphocytic leukemia. His only clue? That persistent scalp irritation. Cancer-related itching is different. It lingers, resists treatment, and may feel unrelated to any skin condition. Sign number 4. Localized itching on the chest or breast area. For both women and men, persistent itching on or around the chest or breast area, particularly around the nipple, can sometimes be an early sign of inflammatory breast cancer or other tumors. This type of cancer often doesn't begin with a lump. Instead, the skin may feel tight, irritated, or slightly discolored. Often, the only symptom is an itch that won't go away. Vicky, 67, experienced this exact symptom. Thinking it was just irritation from clothing, she eventually saw a doctor who detected slight dimpling of the skin and discovered a tumor growing close to the skin surface. This type of breast cancer can progress quickly and may mimic a rash, so persistent itching in this area shouldn't be ignored, especially when creams don't help, and it always occurs in the same spot. Sign number 5, persistent itching in the anal or genital area. Itching in the anal or genital region is often embarrassing to talk about, which means it's frequently dismissed. But when the itch is chronic, without an obvious cause like infection or irritation, it could point to cancers such as anal, vulvar, or penile cancer. Erica, 72, thought his itch was from hemorrhoids. After nearly a year of self-treatment with no relief, he was diagnosed with an early-stage tumor in the anal canal. Similarly, postmenopausal women may mistake vulvar cancer symptoms for dryness or hormonal changes. If itching is persistent, localized, and doesn't improve with treatments, it's essential to get checked, especially if there's skin discoloration or thickening. Final thoughts. Your body is always speaking to you. Sometimes it screams with pain, but other times it starts with something small, like a stubborn itch that keeps coming back to the same place. The 5 locations we discussed today, the lower legs, upper back, scalp, chest, and genital region, are not random. They're areas where internal cancers often send their first quiet messages. You don't need to live in fear, but you do need to pay attention. If something feels off and it doesn't go away, listen to that instinct. Talk to your doctor, ask questions, because the sooner something is detected, the better the chances for successful treatment. If this video helped you, let us know in the comments below. What did you learn, and how will you use this knowledge? Your stories help us create more content to inform and empower others. Please like, subscribe, and share this video. It truly makes a difference. Thank you for watching, and we'll see you in the next video.